Hello, in this video I'm going to be talking about schizophrenia, some psychological symptoms and how it can be diagnosed. It's kind of some things that's going to be covered in this video. So to go ahead and begin with, some of the symptoms that people may have would be delusions, kind of having that false belief that things in reality are hurting or harming or harassing someone, when honestly at the end of the day that's not the case. It's kind of just an imaginary thing that people with schizophrenia want to, in a sense, believe. Another thing would be hallucinations, so seeing or hearing things that honestly aren't there, kind of getting back to the whole delusion thing. Kind of in a false state of reality, and things that aren't real they believe are really happening to them. Another thing would be like disorganized thinking. Now this is going to be for someone who may have like a speech impediment or has kind of a hard time thinking about certain things. That may be a symptom that someone with schizophrenia may have. Another thing would be like abnormal motor behavior. So if you see someone who's maybe in their late teens or early 30s or something along those lines, that maybe, like a full-grown adult, some people may start having a temper tantrum in the store or acting very erratic and very just out there. That would be something that you would want to kind of keep an eye out for in people who do have schizophrenia, because sometimes it can get physical and they may think that you were trying to harm them, but in all reality, they're just having a very big outburst of kind of an emotion type thing. Another thing would be negative symptoms. So changing in, a lack of hygiene or lack of motions. People with schizophrenia normally don't feel like they need to clean themselves all the time, just because it's not something that they think about doing in their normal day, because they're kind of worried about the other things that may hurt or harm them, or what they've seen, not seeing, and things like that. And then the lack of emotions, they kind of want to be shut off and just not really kind of involved in everyone's life or everyone's day-to-day life. So that would be something to kind of go ahead and see as like a symptom of schizophrenia. Another symptom would be like the symptoms of psychosis. So changes in vision, in hearing, in taste, and smell, kind of all those senses that every human does have. Some of those can be altered with people who do have schizophrenia. Now, Americans with schizophrenia are usually diagnosed in their late teens to early 30s. Now, it can happen with younger children. Normally, with younger people, it is a little bit more of a rarer case for them to be diagnosed with this, just because sometimes people with schizophrenia, once again, have those childlike behaviors or those tantrums, so it's kind of hard to truly diagnose when they're a little bit younger, but it is possible for younger children to be diagnosed with it. Now, findings from studies of postpartum brain tissue suggest that environmental influences during the prenatal periods are something that can cause someone to have schizophrenia. That is something that I did find in this research that I was researching. Some of the treatments that people may have: antipsychotics. So this is honestly the preferred method, because this kind of has a low risk and like low side effects. So this is honestly the first treatment they do use in order to try and help someone who does have schizophrenia and this mental disorder to get better and to be able to feel good within their body and not have to worry about are they hearing or seeing or feeling things. So that would be one of the first treatments that people would normally go for. Next would be like an individual therapy, and this can kind of help normalize the thought pattern. And if someone's kind of gotten out of the schizophrenia thing, then if they continue down a path of like individual therapy, then it may help them from honestly having like another relapse episode of going back to the schizophrenic behaviors and attitudes towards everyday life and things. Now, the next one is kind of a more intense one. It's going to be electroconvulsive therapy. Now, this honestly is only going to be for adults who have not responded to the drug therapy, have not responded to the individual therapy. It is more of an intense one, so this is kind of like a last resort type thing. And even kind of like a sidebar, this can also help with someone who also may be suffering from depression, and when they've tried to deal with it, it hasn't worked for them. So some people may use it for this, but schizophrenia, electroconvulsive therapy is a big thing that is used to kind of help treat it for people who don't respond to any other type of treatments or anything. But I did this research. I found a lot of good information to have on it, and I thought it was very helpful to kind of be able to see those future things to keep an eye and look out for. But yeah, so thanks for watching my video.